signs and precautions and flags outside my door. Patient is on standard precautions. Knock, knock. Can I come in?
Come in.
Hi. Provide some privacy.
Hello.
Hello, my name is Vanessa. I'm going to be your nurse today. Can I ask what your full name is?
Harpinder Sandhu.
Okay. Can I see your name badge?
Sure.
And what is your date of birth?
12/7/95.
Okay. And then do you know where you are?
At the clinic.
Do you know what day of the week is?
Today is Friday.
Can you touch your nose?
Yeah.
Okay. Patient is alert and orientated ×3, follows commands, speech is understandable. Okay, gonna wash my hands. So I'm going to be performing a head-to-toe assessment that includes a series of health questions, physical assessments, auscultating and palpating your body areas. If anything is uncomfortable, you let me know.
Okay.
Okay, I'm also going to be assessing for any, assessing your skin for any dressings, wounds, tubes, or dressings that you might have on your skin, okay? All right, so we're going to start off with obtaining a set of vital signs, blood pressure, pulse, respiratory, and pain. Okay, we're going to start off with your blood pressure.
Okay.
On your left arm, feet uncrossed. Okay, your blood pressure was 116/62. Normal blood pressure is 120/80. Now I'm going to assess your pulse for 30 seconds. Okay, and I times it by 2. So your pulse was 62. Normal pulse is between 60 and 100. Now I'm going to check your respiratory rate for 30 seconds. Okay, I'm going to times that by 2, so that's 16. Respiratory rate, normal respiratory rate is between 12 and 20. Okay, on a pain scale from 0 to 10, with 0 being no pain and 10 being your worst pain, how would you rate your pain?
0, no pain.
Okay, patient denies pain at this time. So now I am going to inspect your head.
Okay.
For any bruises, lesions, or infestations that you might have. None is present at the moment. No infestation, no lesions. Head is smooth and symmetrical. Now I'm going to take a look at your face for any asymmetrical findings. No asymmetrical findings. Face is symmetrical with no wounds, lesions, and no droopiness on her face. So now I'm going to assess your mouth. So go ahead and say ah, ah. Okay, stick your tongue out for me. Okay, I'm checking for any inflamed tonsils, any cavities. Mouth is pink and moist. Tongue is pink. Okay, now I'm going to assess your eyes. Can you remove your glasses for me?
Yeah.
Okay, eyes, the sclera is nice and white and moist. Look up for me. I'm gonna bring down your eyelids. Conjunctiva is pink and moist as well. You can go ahead and put your glasses on. Okay. Now I'm going to, oh wait, no, actually remove your glasses.
Okay.
I'm sorry about that.
No problem.
So I'm going to assess for perla now, which is pupils are equal, round, reactive to light, and accommodation.
Okay.
So your eyes, okay. So your pupils are in the center of the iris. Your pupils are equal in size. They are round with no abnormal shape. Now go ahead and look at the wall for me. I'm checking to see if they dilate. Okay. They do react to surroundings. I'm going to shine the light in your eyes. Okay, your pupils do constrict equally, and I'm going to check for accommodation, which is the 6 cardinals of gaze. So we'll stare at the pen and don't move your face. Okay, patient's pupils are equal, round, reactive to light, and accommodation. No signs of strabismus, nystagmus, cataracts, or vision loss.
I'm happy to hear that.
Oh, good, good. Okay, now I'm going to inspect your neck, your midline tracheal. Okay, and then look left to right, up and down. Okay, neck is symmetrical with neck is symmetrical, erected, and straight with full range of motion. Go ahead and look to the left. No jugular vein distension noted. No central line present at this time. So now I'm going to assess the cranial nerves.
Okay.
We're going to start off with the vision, 2, 3, 4, and 6. So I want you to stare at my pen. Okay. And now we're going to perform the Snelling chart here.
I will use my glasses for that.
Okay. So cover one eye.
E, F, Z,
Cover the other eye.
E, T, D.
Okay, my patient can see at a distance of 9 feet. Visual acuity is normal. So now I'm going to assess cranial nerves 5 and 7, which is your trigeminal facial nerves. So smile, frown, wrinkle your forehead, puff your cheeks, stick your tongue out, left to right. Okay, very good. Now I'm going to assess cranial nerves 9, 10, and 12, which is your mouth. So swallow. Okay, I'm going to check your gag reflex. Open your mouth. Okay. And then swirl your tongue around for me. Okay. Now I'm going to assess cranial nerves 11, which is your spine. So I'm going to provide some resistance. Okay, I'm going to show your shoulders. All right, squeeze my fingers. All right, go ahead and stand up for me. Feet together, palms up, close your eyes. Here I am assessing for any positive pronator drift. And she does not have any pronator drift because her palms are facing upward. Arms are symmetrical and straight. Okay, go ahead and have a seat for me. Okay, so have you had any, do you use any oxygen?
No.
Any cough? Any sputum?
No.
Any shortness of breath?
No.
Any chest pain?
No.
Okay, so I'm gonna expose your anterior for any lesions, any wounds that you might have, okay? Now I'm going to inspect the contour of the pericardium. Okay, no cardiac scars, bulges, or edema. Okay, now I'm going to palpate over your valve sites. Aortic valve, pulmonary valve, Erb's point, tricuspid valve, and mitral valve, which is your point of maximal impulse. Okay, no no visual pulsations, nor crepitus felt. Now I'm going to auscultate over your same cardiac landmarks.
Okay.
Aortic valve at the second intercostal space. Pulmonic valve at the second intercostal space. Erb's point at the third intercostal space. Tricuspid valve at the fourth, fifth intercostal space. And the mitral valve at the fifth intercostal space. And this is also your point of maximal impulse. I'm going to listen to it for a full minute. Okay. So no extra sounds, murmurs, clicks, or rubs heard. Okay. Now I'm going to check the same parts but with the bell of my stethoscope.
Okay.
Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. Okay, same. I did not hear any clicks, any murmurs, any rubs.
Okay.
Okay, now I'm going to auscultate your lungs. Take a deep breath for me. Okay, no wheezes, no crackles, no stridors heard. Now I'm going to expose the posterior of your back here.
Okay.
And I am inspecting for any wounds, any lesions that you might have. Okay, now I'm going to auscultate your lungs. Take a deep breath. Okay, no wheezes, crackles, grating sounds heard. Now I'm going to palpate your back and say 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile firmitis was felt. Okay, now I need you to lie down for me.
Okay.
No, actually sit up for me.
Oh, okay.
I'm sorry about
No
that.
problem.
I'm going to assess your upper extremities.
Okay.
Okay, so I'm going to start off with checking the color and the temperature of your skin. Color is normal for ethnicity. Temperature is warm and dry. I'm going to check your pulse radially, bilaterally. Rate is normal and rhythm is normal. Okay, I'm going to check for your capillary refills. Okay, capillary refill fills in 2 to 3 seconds. Nail beds are healthy, firm, and at level. Now I'm going to check for any peripheral IVs you might have, PICC lines. Okay, none at this time. And then I'm also going to check your strength. So I want you to squeeze my fingers. Oh, very strong. Okay, go ahead and lie down for me this time.
Okay.
Okay, when was your last bowel movement?
Last night.
Last night. Any constipation?
No.
Any nausea or vomiting?
No.
Any abdominal pain?
No.
Okay, so I'm going to start off with inspecting your tummy.
Okay, sure.
Okay, I'm gonna roll this up
Okay.
and pull this down a bit. Let's see your belly button. Okay, I am going to inspect her tummy for any lesions, any wounds, any bruises. Okay, none noted. And tummy is flat, no protrudent areas, nor any scaphoid noted. Okay, now I'm going to auscultate your, oops, well, there was my pen. Now I'm going to auscultate your tummy. For any bowel sounds. Ooh, I hear them. Okay, your bowel sounds are occurring every 5 to 15 seconds. Okay, now I'm going to palpate your abdominal area. And let me know if you feel any pain.
Okay. No pain.
No pain?
No.
Okay.
No.
Okay, so I didn't feel any masses, distension, or any hard areas on her abdominal area. Now I'm going to check for rebound tenderness. I'm going to press on your stomach, okay? Any pain?
No.
No rebound tenderness at this time. So now I'm going to assess for urinary function. So my patient does not have a Foley catheter right now. So if my patient did have a Foley catheter, I would inspect the Foley and the bag and reassess if the patient needs a Foley catheter at this time. Okay, when did you last urinate?
Hour ago?
An hour ago. Okay, do you not have any swelling, redness, discharge from your genital areas?
No.
Okay. What's the color of your urine?
Normal.
Odor?
No odor.
Okay. So now I'm going to check your bladder.
Okay.
No masses or distension at this time. Okay. I'm going to take a look at your perineal area. Is that okay with you?
No, I don't feel comfortable with that.
Okay, that's fine. Can I ask you some questions?
Sure.
Okay. Do you have any, I know I asked you, but can I ask you again?
Sure.
Okay. I'm so sorry about earlier. Do you have any redness, any swelling, any deformities on your genital area?
No.
Okay. Any trauma or injury to your genital area? No? Okay. Are you concerned about HIV or
No.
STIs?
No.
No. When was your last menstrual period?
Last month?
Last month. And how often does it occur?
Every month?
Every month. Okay. When was your last pap smear?
A year ago?
A year ago. Okay. All right. So go ahead and sit up for me.
Okay.
I'm going to check your lower extremities for circulation, sensation, and mobility.
Okay.
Okay, so go ahead and push, pull. I'm going to check the temperature of your skin. It is warm and dry. Color is normal for ethnicity. Check your edema. Any edema? No edema at this time. Capillary refill. 2 to 3 seconds. No, nail beds are normal, firm, and healthy. So I'm going to check your radial bilaterally on your posterior tibialis. Okay, and then your dorsalis pedis. Okay, both the pulse is, the rate and the rhythm is normal. Okay, so go ahead and lie down for me on your side.
Okay.
Okay, here I'm going to expose your back, check for any lesions, any stitches, wounds, or dressings you might have. Okay. Now I'm going to check your heels. Heels are blanchable. I'm going to check your buttocks for any sores, any wounds. And your skin is blanchable. And I'm going to check for your bony premises, occipital, shoulder, sacral, buttock, hip, knee, okay, heels, okay. No skin breakdown on bony premises. Okay, go ahead and lie in a comfortable position. How do you feel?
Good.
Good? Okay, so here's your call light.
Okay.
And I'll put your bed down. Okay, do you need anything before I go? No? Okay. So I'll see you then.
Bye.
All right, wash my hands, open the door, close the door.